So don't waste time here. Just go see Kanyakumari, do some relaxation thing. Come tomorrow morning fasting without having breakfast. First case for you. So 9 o'clock we'll start. All right. Any other doubts you have, doctor?
Yes, I just wanted to ask.
What type of chin are you looking at? Very strong male chin or just male chin with 10 millimeter advancement like that?
Sir, so actually concern is regarding the isolate chin only.
Correct.
But I just want to ask you regarding what else I can do to make it better.
Only that will make a big difference. Of course,
so
we
how
can.
about the nose?
We can improve the nose if you want. It's not that we can't improve, but this is a bigger concern. If you want, we can combine it. If you want, we can do it separately. I think you do it separately because this is a really big concern for you. You have a big nose, so do this, and then again, if you feel like we can do the nose later on, reduce the weight, some things we can do. But this will make a big difference. Huge difference.
And how about the angle?
No need. Only Genioplasty is enough for you.
Because anyhow I'm like undergoing surgery and just wanted.
Yeah, I know you understand. You're undergoing surgery, so you can add more procedures. But see, this is going to give you maximal improvement. No need. You do this and see. No, if you're very happy, you will be very much happy. Still, if you want, after that, you can consider.
So, so these are all my face fat actually. Since 3 years
That will reduce now. Once we do the Genioplasty, the whole area will improve. There's a little asymmetry also you're having and receded chin. Everything will correct. After that, suppose you're asking some nose and all.
Actually, my face was so kind of thin, sir. Actually, but,
now you put on some weight.
I have put on weight, so everything is fine now. So because of that, so will there be a difference?
No.
Diagnosing or something?
Nothing will be there. We'll be able to give you good result. Morning you come at 9 o'clock, doctor. Don't eat anything. Don't drink anything. Come here by 8:30. So we start by 9. And now you can go. Blood test tacha. So we'll finish your blood test. Just basic. And you meet the executive, finish that payment issue, everything, and then you leave. So it's easier tomorrow that you. Nothing you should do.
I'm just concerned.
Don't do all that. Nothing we did. Yeah, go ahead with the questions.
If you have time.
Yeah, of course you have time. Who?
1.5 year old baby, lips revision. She's fasting 4 hours over.
We'll do it there on top.
Sedation can be given under the vision.
Can't hold her. Yeah. That's the easiest thing. Don't do IV, I'll take a lot of time.
You can just filter questions.
So you have to have a symmetrical, proportionate, masculine jaw. That we are doing now. Only with this we will be able to get you result. Why not make the appear? Yeah, that is possible. If you want rhinoplasty, we can do. Because you are, see, if for example, Genioplasty will make, let us say, 70% improvement in your face. Another 20%, 30% you want, we'll do rhinoplasty. That is your decision. If you ask me, I'll say Genioplasty is more important in your case with jaw sculpting. But we can do rhinoplasty if you want. So model like face jaw, absolutely. So your face will get more proportional and you will have much like a proportional face. Maxilla, no need to do anything. Your maxilla is good. Don't touch the maxilla. Don't touch the overbite. Don't touch the lower lip. Lower lip will automatically become thin and slightly better when we do this. Jaw surgery you don't need apart from this.
Jaw sculpting you need.
That we are doing now. Genioplasty, I am doing that. But now no the jaw surgeries are needed. So only because of your questions, only thing if you want we can do rhinoplasty. So I can reduce the weight. I think it's not needed. That's so because your concerns are all about facial aesthetics. So if apart from this, that will help you. But don't do any upper jaw, upper lip, eyelid, nothing else is needed. Any more?
No, sir.
One more paper was there?
No, sir. This would be.
Okay, fine.
You can do the normal workout gym later on.
4 weeks, 5 weeks later.
And one more thing, the smile can be corrected or is it fine?
It will already improve with this. So I don't think you need to do a separate procedure for that.
We are doing only sliding.
Not exactly sliding. It will be both vertical and horizontal augmentation. Sliding Genioplasty, only horizontal augmentation.
How much mm could you?
I think we should do from your questions maximum 14, something like that, because you want a
Can we just
yeah, come. We can see here.